The Enhancing Quality programme affects all the hospitals in Kent, Surrey and Sussex, and it's a programme whereby patients presenting with certain common conditions, including pneumonia, heart failure, patients with knee or hip problems, dementia, patients with acute kidney injury, all have interventions that have been proven to improve their outcome every single time. And by doing that, the outcome for patients with these conditions will improve both within the individual hospitals and also across the region.
National guidance at the moment focuses very strongly on indicators of performance, which serve two main purposes. One is to improve quality, but the second is to allow a commissioning structure so as to both improve service delivery and with it quality. What we have with EQ is a programme doing that in the South East that's already set up and has demonstrated its fitness for purpose to deliver that sort of agenda.
The Enhancing Quality programme is already raising standards and consistency of standards for patients through this region. We're now entering a period where there will be much greater emphasis on patient choice, and patients will be able to use the data from the programme to make more informed choices about where they have their care.
From a Chief Executive's perspective, the Enhancing Quality programme is absolutely fantastic because it provides us with a hugely positive and powerful tool to actually enable us to improve quality of care, patient experience, and also the effectiveness of the interventions and the care that we give to patients.
The EQ programme has highlighted heart failure as more of an issue. It's become higher on the agenda for the Trust, and it's also helped us to relook at our pathways and redefine our pathways so they're much more streamlined across secondary and primary care. We've introduced a stamp to identify patients more readily and get them onto the right pathway. We've also introduced a transfer of care document, which means that we can document what education and what treatment the patients have actually had while they're in hospital, and then that can be carried on in the community.
Most of the patients that I talk to are finding real benefits from having a formalised care plan which details how their conditions are going to be managed, but also they're coming out from hospital with a lot more information and are better prepared for the challenges in front of them.
Locally, Enhancing Quality is allowing service providers to recognise the needs of their local populations, and it's also helping them to identify how they need to look at collecting data so they can recognise what their needs are, and those two things together are allowing both primary and secondary care to work together towards creating better services for people.
Enhancing Quality has helped us in a number of ways. One specific example I can give you is about heart failure patients. We've learned through the process that we weren't giving consistent enough care to the patients who came into Worthing. So what we've done to alter the process is to set up a new heart failure ward, which is adjacent to our consultants and our multidisciplinary teams of nurses. And of course that ensures that we get the best possible outcomes for our patients.
It's been an interesting 18 months. It's taken a little while for many of the processes to be up and running, to get the system collections in place, to help everyone really get it and understand what it means for them and for patients. But once they've got it, once that light's been switched on, it's been phenomenal. The individuals involved have been really dedicated in terms of improving outcomes for patients, and they've seen the Enhancing Quality programme as a way of doing that.
The main challenge, I have to say, when EQ first came out was a lot of scepticism between consultants, but I think those who have a passion to develop the heart failure service, we used it really as a vehicle to try and make that change. And once I think we've got everybody on board, it made things a little bit easier to use it in a positive way.
One of the real challenges that we faced in the organisation when the Enhancing Quality work came online certainly involved convincing a lot of the clinicians of the value of the measures that we were going to use. In at least two of the pathways, the measures that are currently being used weren't felt to add value to the quality of their patients' care. But we were able to show them that actually, although they felt that they were actually performing well against these measures, the evidence and the data early on suggested that they weren't. And so until they could do the simple things, they wouldn't be able to tackle the more complex things.
The data from EQ has proved a powerful mechanism for driving change and change for the better. Across the NHS, we're not great still at collecting quality data, and EQ gives us that. It gives us month by month real-time data on how we're doing, And of course, when you see real data, you want to improve on it, and it is driving improvement.
Well, certainly since the first collaborative event, I have noticed a change in people's perceptions of clinical coders and their abilities. We are only able to translate what is actually written in the case notes. If it's not written, then to a coder, it hasn't ever happened.
I think one of the advantages of the EQ programme is the collaborative approach to working. It's been really, really helpful as a mental health organisation that we're not working in isolation, that we've been able to work with colleagues in other mental health organisations in the South East Coast, but also our colleagues in the acute, to look at how they measure and collect data and what we can learn and what they can learn from us.
Data is very useful for driving change, but through the collaboratives we're able to bring all the individuals together, specialists involved in those care pathways from different organisations, and share what they feel is best practice. And the central point of the programme is to spread that through the whole region, and I think the collaboratives do that very well.
It's one thing to have the data and present it, but people need permission to think differently. They need to be given examples of ways to change their practice or to enhance their practice through their team. The collaboratives work by giving them the opportunity to meet and talk to people doing the same thing in a different way and getting perhaps better or enhanced results. In that sense, they're pretty much unique. I think the collaboratives add a second value. I think if you're giving the data back to the clinician in a public forum, I think that, again, is quite a strong incentive for the individual clinicians and their teams to seek out best practice from their colleagues.
There have also been some unexpected outcomes in terms of being involved in the EQ and Enhancing Recovery programme. It's brought a lot of our teams together because we have a single purpose, a single goal, which is about improving outcomes of care for patients.
One of the main benefits from the EQ programme that we feel is that patients are being contacted or being seen within 2 weeks from their point of referral to the heart failure nursing services. We feel that's a real benefit for the patients, but also it's driven forward the quality of the services that we're providing.
What this will mean for patients is we will be able to demonstrate to our colleagues in primary care and the acute trust, by referring people early on in their illness, that we can actually develop the pathway so people are receiving the right service at the right time, at the right stage of their illness, and actually support not only just the patient but the carer and their next of kin in that journey.
The direct benefits from the EQ pathway for pneumonia are around getting the right diagnosis quicker, the right treatment quicker, and the outcome measures suggest that that's leading to reduced length of stay in hospital and a better chance of surviving what is a very serious illness.
Being clinical director for EQ has been a tremendous advantage to me in that I now look for variation in practice. Everybody comes to work trying to do their best, every doctor, every nurse, but to have a framework whereby I know that if I do those 5 things or those 7 things, that the outcome for my patients will be better is very reassuring.